having a discussion about the intersection of mental health issues and special education. We think this is a very timely discussion, and we have some very important information to share with you about mental health and special education.
You know, Julie, in my special education law practice, I've been noticing, and I know we've talked about this quite a bit, an ongoing trend upward of students, particularly adolescents, who have mental health issues that are impacting them educationally. Maybe not academically, but certainly socially and in other behavioral ways. And so this is an area that, from my perspective, really needs a lot of discussion because, in my view, and I've talked to you about this and a lot of other people, kids who have what we would call an emotional disturbance, which is the special education category for it, are probably the least identified, evaluated, and the least well-served population of students with disabilities in our public schools. And there are a lot of reasons for that, at least as far as we're concerned, which we're going to get into in a little bit. We hear the term mental illness thrown around quite a bit, but it's kind of hard to know what is mental illness.
Well, I recently interviewed Dr. Jeffrey Landau. He's a board-certified child and adolescent psychiatrist in Connecticut, and we're going to be referring to him throughout our discussion this evening, and he's going to be able to share his expert opinions on mental health.
I would say that there's typically broad categories in which mental health issues can present themselves. One is general mood symptoms, whether it's on the low end, where you're very depressed, down, lethargic, or on the other end of the spectrum, where you have a more elevated or irritable mood. That would be one category, would be mood disorders. The next category would be anxiety symptoms, and those, again, have a wide range of presentations. It could be general anxieties, worries about the future, worries about how I'm relating to others, worries about how I'm functioning. It could be more obsessive compulsive types of worries or anxieties, that I have certain actions that I need to do to prevent bad things from happening. Those are some of the worries I might have. Or it could be presenting as panic symptoms, where just either talking in a large crowd or out of the blue feeling overwhelmed by certain anxiety symptoms that come unexpectedly, where my heart starts racing and I get flushed and get very nervous and anxious. So that would be anxiety category. And then the next category would be more psychotic spectrum illnesses, and those would be presented usually by withdrawing from some of the social relations, sometimes beginning to have unusual thoughts or beliefs in which it impacts your functioning. You begin to have other sense that people might be talking about you, saying things about you, or that you actually are hearing things or seeing things that become concerning to you. And those would be, I would say, the three broad categories. It's anxiety disorders, psychotic disorders, mood disorders.
Mental health finds its way into the news, and it's often associated with violence. So I asked Dr. Landau if there's any correlation between mental health and violence.
I know there's been a lot in the news about association between mental health issues and violence, or psychiatric disorders and violence. And what I would say is there's no association between somebody having an underlying psychiatric condition and being prone to more violence. I think if you really look statistically, it's no more than what's out there in the general population. And that there's no there is no one psychiatric presentation or underlying psychiatric disorder that specifically has aggression or violence as its underpinnings.
So as you can see, there's a broad category of mental health issues.
Yes, and for that reason, parents are often confused as to when the time is right to seek out an evaluation by a mental health professional. Many parents start with their pediatrician, but they're not quite sure when is the time that I should go and actually have my child evaluated.
Well, I asked Dr. Lando that question. Let's take a listen.
The time that you begin to want to get a mental health evaluation for a child or adolescent, the concerns that I would say would rise to that extent of looking for an evaluation would be the level and degree that their social, emotional, or academic functioning is being impacted. You're looking at how they're doing academically, if there's a decline in their academic functioning. You're looking at how they're doing socially, if it looks like they're becoming more isolative or having a more difficult time sustaining friendships or family relationships, as well as how they're presenting and functioning individually. Are they getting up, getting dressed, doing the things they need to do to function on a daily basis? If there's concerns in any of those areas and they're rising to the point that they're really impacting a child or adolescent's functioning, that's when I would say you would want to get a mental health assessment.
So we're at the intersection of mental health and special education. That's mental health, the medical model, and the intersection of special education, which is the educational model. And that's what we want to talk about.
Yeah, and it can be extremely confusing both for parents and educators and medical professionals because those areas, they often interact and parents don't know the terminology. And so we want to talk a little bit about the terminology, but I'll just give an example. So a parent very often thinks, my child has some kind of a diagnosis, I'm going to treat this medically. So let's just say a child has obsessive compulsive disorder. And the parent says, at home, my child has to wash his hands all of the time. He has to count how many times he locks the door before he leaves, whatever the symptoms are. And that family may be treating it medically with some kind of an outside mental health service provider or a therapist. It's when those kinds of things bleed into school and make it very difficult either for the student to learn or to access their education that the educational model comes in. And so as an example, if a child requires accommodations, such as being able to go to the bathroom more frequently to wash their hands because of an obsessive compulsive disorder, they may not require instruction that's different. They may not require specialized instruction, but they might need something called a 504 plan for accommodations. However, if every time the child interacts with a certain group of peers, they become so anxious that the symptoms become worse of the obsessive compulsive disorder, that child might actually rise to the level where they require specialized instruction from educators, mental health service providers on how to cope, how to deal with that anxiety. And it's really based on the individual child and what they need, and a team makes that decision under the educational model as opposed to a doctor making a decision under the medical model.
Why is it so difficult to get services, interventions, appropriate help for children and adolescents with mental health issues? What are these barriers about?
Well, a lot of them are societal, philosophical. We unfortunately continue to have some veil of shame that surrounds mental illness. And for parents, which I think is the first place to start in terms of the barriers to intervention, often they're afraid to tell anyone what's going on with their child. Or sometimes the child, particularly if it's an adolescent, is embarrassed. So as an example, let's say you have a student who has a depressive disorder and has attempted suicide. Sometimes the kid is really embarrassed and begs the parents not to tell the school. And often those attempts happen outside of school and in the home. And if the school's unaware of it, they're not going to know what to do.
Right. Well, this is really difficult stuff on a family level. But we asked Dr. Lando to talk about some of the barriers that families face.
I would say barriers for families to get interventions for their child who has or have mental health issues are a few-fold. I think one could be a family's own sense of stigma and worry about what does this mean to acknowledge that my child has a certain mental health presentation. And so there may be hesitancy of even trying to access certain systems. The second, I think, would be some wariness of some of the community agencies that are out there in terms of how they may interact or intervene as part of the overall mental health system. And then I think thirdly, it's not necessarily being educated around or knowledgeable around what are the things I should know about mental health issues as well as educational issues, and what are the resources that are out there. I think the resources are constantly changing, and I would say even as a mental health professional, it's hard to keep up with, well, what services are available and who's in charge of accessing that, and where exactly can we find those resources. And so I think it's trying to keep that dialogue as open and as robust as possible to keep ourselves as informed as possible as to what resources are out there.
In addition to these barriers that were identified by Dr. Lando, there's another barrier to intervention for students, and that's that parents also unfortunately have a negative connotation associated with special education. And that's a shame, because special education is an absolute necessary service for so many students. But unfortunately, many parents associate special education with something that it's not. They assume that it's for students who are not intelligent, which is not often the case. They assume that their student is going to be removed from the mainstream for a good portion of the time, or that they're going to be teased. And there are some real concerns that parents have about whether or not their child should receive special education services. But more fundamentally than that, Julie, it's just that many parents really do not know that under the special education laws, there's a category called an emotional disturbance.
So let's define emotional disturbance. An emotional disturbance means a condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree that adversely affects a child's educational performance. An inability to learn that cannot be explained by intellectual, sensory, or health factors. An inability to build or maintain satisfactory interpersonal relationships with peers and teachers. Inappropriate types of behavior or feelings under normal circumstances. A general pervasive mood of unhappiness or depression. A tendency to develop physical symptoms or fears associated with personal or school problems. Emotional disturbance includes schizophrenia. The term does not apply to children who are socially maladjusted unless it is determined that they have an emotional disturbance. There's also barriers for school districts, and I spoke to Dr. Landau about this, and let's take a listen to what he has to say.
I think for school districts, in part, there's, just like with families, I think there's a sense of we could do it ourselves. That there is a sense of we're a capable team and we should be able to do it ourselves. And so there's a bit of hesitancy of asking for outside assistance or support. Additionally, I think just like with families, at times there's lack of knowledge about what are the resources that are out there and what are some of the resources that might be appropriate to try and get implemented to help this child grow socially, emotionally, and academically. And then lastly, I think there's always a bit of a balance between what's the least restrictive educational environment and what are some of the financial costs of the resources that are needed.
Very often Julie and I are brought into a particular case because a student who has mental health issues is in crisis. And in that crisis is where that intersection occurs between the medical model and the educational model. And so many parents get stuck in this intersection, and that intersection basically becomes a dead end because they don't know what to do next. So Julie, let's talk a little bit about how we can have parents use the medical system to help them get their child some assistance in school.
Right. Well, this is really where the rubber meets the road. There's often a struggle between this medical model and the educational model. And so we want to give you some tips on how to get the best information you can out of the medical team, know what to ask for so you can bring those recommendations on how your child's mental health issues may be adversely impacting their education, right. Okay? And so how to ask for the proper things from the medical team to bring over to the school team. We don't want you to have that struggle. We want you to get through this intersection safely at a really good destination. So let's take a listen to Dr. Landau.
If a child is hospitalized or is receiving some type of intervention that is taking them out of the school system for anywhere from a couple days to weeks, what are some of the things that parents should be asking mental health professionals to help with that transition back into school? And I think on that, I would say bringing it up as you're meeting with the mental health professional. While we would hope that we're thinking about those things, I think sometimes, particularly within a hospital setting, it's crisis intervention and stabilization. Let's make sure that the family system is safe, and we're just looking at safety, and we're not necessarily looking at the broader world in which the child's living, which is including their educational life and even their extracurricular life. So I think I would encourage parents to, as they're meeting with the hospital team that's working with their child or their adolescent, beginning to raise the question of, well, what should we be looking at in terms of academics, in terms of education? Should we be asking for any types of meetings? Do you think my child needs any additional supports within the school? And at the end, I would ask for a discharge summary that really talks about what's my child's diagnosis and what are the recommendations or the thoughts of how that particular diagnosis may impact my child's overall emotional, social, and educational functioning.
So that's really great information from Dr. Landau. In addition to that, we have on our website, yourspecialeducationrights.com, an entire series dedicated to what to do if your child is in a psychiatric hospital. And we, in fact, break it down into 3 categories. What you do if your child has an IEP and is in a psychiatric hospital, what to do if your child has a 504 plan and is in a psychiatric hospital, and what to do if your child isn't identified for either and is in a psychiatric hospital. So we suggest you check that out.
We also have a downloadable sample letter that you can write to the medical team, whether that's at the hospital or perhaps your child's psychiatrist or treating physician, asking that team or that person the type of information that you're going to need to bring back to the school. So we've got that sample letter on our website as well.
So now it's time for Q&A. So Julie, what's our first question?
Well, we've got a question from Laura from New York who asks, Jen, what if my child needs a residential program? Is that my responsibility or the school's responsibility? Well, that's a big one.
It's a big question. It's a $1 million question, and it's a tough one, and it's very dependent on the individual unique needs of the child, as all special education decisions are. What's important to remember is that these decisions are made by teams, either by 504 teams or IEP teams, special education teams. So it's not a yes or no question for us to answer, but what I can say is this. Like many areas of the special education laws, there are times where the answer to a question depends on where you live. And that's because in our system of government, we have circuits, federal circuits that interpret the statute, the federal statute. And so some circuits have a certain test for whether or not a residential placement is an educational placement. So if it's the responsibility of the school district for special education needs. And that test may vary depending on where you live in the country. So this is definitely one of those areas, Julie, where you definitely want to have an idea from someone in your own state, in your own circuit, as to what the test is, but ultimately it comes down to a determination really as to whether or not the child has received an appropriate program that the school district has offered, and if not, is the placement that the family is seeking or that is being recommended to be a residential placement what the child requires for special education reasons. And again, there are different tests depending on where you are in the country, and so in some places that test is, are the educational issues inextricably intertwined with the emotional issues? Okay, so that's one kind of test. And then there's another test that looks at the placement, the residential placement, and asks, what's the primary purpose of that placement? Is it to remediate an academic issue or a medical issue? And that's another test. Then there are other decisions that say, really just look at the statute. You don't need to craft a judicially crafted test. You just look at the statute. So it's not an easy yes or no question.
No, none of our questions are ever really easy because there's so many variables involved. And yes, while it's one federal statute and that federal statute is the same, the way that it's interpreted in the various districts or circuits, in this case circuit courts. So Jen, how would a parent find out what their circuit might say about something like this?
Well, and that's a really tough one, because short of talking to an attorney who's highly experienced in this field, you're probably not going to get that information even from your state Department of Education in all likelihood. Right. Your state Department of Education might have guidance as to how they are telling school districts to analyze whether or not a residential placement is necessary for educational reasons. Again, it really, though, always comes down in all of these decisions to the unique needs of that child, that IEP, an individualized education program. So for some students, the statute, the IDEA, the federal statute, contemplates that at various points in that child's life, they may require a much more restrictive program like a residential program, or even a hospital at certain points, as opposed to a mainstream program in the local school district. So it really just depends on the child and the case.
Okay, well, we've got another question. This one is from Stephanie, and she's in Ohio, and she asks, what if my hospital won't provide any recommendations through the discharge summary?
That's have you had difficult hospitals with your clients? I have.
Oh, absolutely. Yeah. And I think again, we're this is speaking to that disconnect, and it's really the whole reason that we wanted to do this web show on the intersection of special education and mental health, because again, that the hospital and the treating psychiatrists or the doctors may not be on the same page and looking at this through the educational model lens. But that's a really good question. What if the hospital is not budging and they're like, we're not going to give you any recommendations?
And I've had that. I've had situations where the hospital won't even give the parents the discharge summary, which they want to share with the team at the school, and we have to try really hard to get it. Sometimes it can actually help if the school tries to seek the discharge summary with the parents' permission to do so for whatever reason. And, it varies very much depending on the hospital. Obviously, sometimes the problem is that they're very busy and they're super focused on that medical model, as you said. They're not thinking about how this child will be impacted in school. Over time, psychiatric hospitals that have a lot of experience working with children and adolescents with disabilities start to understand that they're just going to see this kid back if the kid is sent into a program without support. And so I've found that over time it's helpful, but it's like any other service provider that you're working with. If they're not going to be helpful to you, you might have to get the information another way. And that's kind of hard then.
Might that way be that you call an IEP team meeting with your school and get your concerns on the record that my child, my adolescent, has been hospitalized. You're very concerned that this new mental health diagnosis is going to adversely impact his or her education. It might be that the student prior to being hospitalized would refuse to go to school. Well, you can't get an education if you're refusing to go to school. So in that case, might it be that you go to the IEP team and say, I'd like you to evaluate my child by a psychiatrist because I suspect XYZ mental health issue.
Absolutely, because if the bottom line is you can't get those diagnoses from that hospital, or you can't get prescriptive recommendations that the school can use, you're going to have to ask the school or some outside person to do an evaluation so that you can bring that information to the team. It is the school district's obligation to do that evaluation in all suspected areas of disability.
But to play the devil's advocate here for a minute, a school may turn around and say, well, that's a medical diagnosis.
They often say that.
All right. And so let's talk about that, because if in fact a medical diagnosis is adversely impacting education, that can very well be the responsibility of the school district.
No question about it. And again, that goes back to that definition we gave earlier of the emotional disturbance under the IDEA. It is a special education category. And so it's important to just keep in mind that, you know, this kind of response, it's a medical issue, not an educational issue. The example you gave of, you know, if the kid's not going to school, obviously that's impacting the child educationally. That's actually the model I see most often. Not always, but the model I most often see for students who have emotional disturbance that aren't identified yet is they stop going to school, which should be a red flag to the team. This is a red flag. But instead, what I hear when I bring the parents' concerns to the team is, when she's here, she does a great job, which is incredibly frustrating to hear, because if the child's been there, the student's been there 4 days that year, that's not a whole lot of time to know, and that is clearly adversely impacting. So I would say absolutely, if your psychiatric hospital or your outside providers won't work with you to help get information to the team, you're going to have the team gather information some other way.
And the way that I really look at that is sort of two camps. There's sort of the post-crisis, where something that your child or adolescent has been hospitalized, and you're sort of in crisis as a family, and now you're sort of taking that reactive approach versus a proactive approach when you feel that there's something about to happen, things are not improving, you're sort of getting the sense that maybe your child is not going to school anymore, or is in the nurse more than she's in the class. These types of things that you then may take a more proactive approach and call for an IEP team meeting to say, would you please evaluate my daughter or son?
After the crisis is sometimes a very difficult time to do it, because and most of the time a parent has had a feeling, not always, but a parent's had a feeling for some time that there's a problem. So time for an evaluation.
Ready for another question?
Yes, of course.
Okay, let's see. Well, we've got Deb from Connecticut, and she says, where can I find the sample letter you talked about earlier?
Okay.
Good question, Deb.
Very good question. We're going to be posting that on our Facebook page for now, and then it'll also be up on the yourspecialeducationrights.com website. And if anyone's seeking it, just join the site and ask for it, and I'll be happy to attach it through a message to you. All right. Again, it's a sample letter. You may want to individualize it, but it's just a sense of the kinds of things that you should be asking your team to share with your school district.
Right. And, you know, when we put that sample letter together, just a little note about that, you know, there are so many variables in this. It could be a letter you write prior to hospitalization, post-hospitalization, but the things that you want in every letter are there. Obviously, you have to stylize the letter to your own individual circumstances, and you know, hopefully that's understood. So Henrik from Wisconsin says, should I give the school discharge summary to the school? Well, this is an easy one. I think the answer is yes, but let's go into it a little bit more.
I think the question really is that I'm guessing that the real question was whether or not they should give the school the discharge summary. It's a little So here's the thing. The short answer is yes. This is where Julie and I find that very often people get stuck by not wanting to necessarily disclose information to the school. You're not required to share medical information with your school district. And so, you know, it is within your legal right to not do that. And there may be reasons, and again, Julie and I are giving general information, global information, but there's always an individual situation which may depart from that, the general rules, right?
It's important.
So, but it's important to be cooperative, because if you're going to be seeking identification, evaluation services from your school district, and you've prohibited them from getting information about your child, later, if you disagree with their decisions, it's going to be very difficult for you to do so, because their response will be, but we wanted the information and you wouldn't give it to us. Now, sometimes there's information contained in discharge summaries or in outside evaluations that's highly sensitive, not just about the student, but family issues. And that can get very dicey as well. Often you can ask for the doctor to redact a section of it and explain that this is not about that. Again, can get dicey because the school will be immediately wanting to know what's in that section. It's not an easy situation to handle, but you do have rights to decide which information you're going to share with the team. But in terms of a discharge summary from a psychiatric hospital, usually that contains a lot of important information about diagnosis, etc. My view is it's smarter to share it with the team than withhold it, but that's my view. And
and again, the option is, if you're not going to, then you might not be seeking services through the public school system to support your son or daughter, and you may choose to not tell anything to the school district because you don't want anybody to know. But that's always your option. That's always your option.
That's right. But what we're talking about is if you want to avail yourself of the services that are available under the federal special education laws, you're going to have to be pretty open with your district. Now, I will say one little somewhat of a caveat. Usually discharge summaries will include if the student has any alcohol or substance abuse difficulties, and in fact, if they reach a diagnosis with a cannabis reliance or something of that nature. And then it can turn into a red herring where the school becomes so focused on the substance abuse issues rather than the possibility of special education issues. That could be a whole other web show, and maybe we'll do one on that, because students who have disabilities are highly vulnerable to, more so than just the general population, to drug and alcohol abuse. So what you want to make sure is, you have information from the doctors. Is the student self-medicating through the use of drugs or alcohol? Because that often happens. Students who aren't identified are self-medicating. And it's a chicken or egg question. Just because a student has a disability or a diagnosed psychiatric condition doesn't mean that, like all adolescents, they may not at various points struggle with this issue, and it doesn't mean they're not entitled to special education services. So don't let it don't get stuck on that.
People may want to focus on that drug issue and then make the special education issue or the 504 issue sort of take a back seat.
And so often my clients, what we recommend that they do is they regularly drug test their child so that we can prove as we're going forward in the process that the student was clean after the hospitalization.
And not to have everybody wait for another series on this, but oftentimes a student may get arrested while all of this is going on. And on top of the issue of trying to find an appropriate placement, or what IEP goals should we have to support your student, whether it's at the public school or in a different setting, there's an arrest that goes on. And now you've got to deal with a whole other layer. And that does get very complicated.
And I always say, the most important thing if your child is subject to an arrest or criminal charges is to get a good criminal lawyer, because as important as education is, and it pales in comparison to freedom. And so, you want to make sure you're taking care of that criminal issue first, because there are lots of implications to the criminal matter, including Fifth Amendment, your right to remain silent, and all of those things. And again, we'll do a whole web show on discipline at some point, but you're absolutely right that there's a lot of interplay there.
It adds another layer, and in my experience, if that does happen, the police with whom you are dealing, it is helpful to let them know that there is a special education issue going on here. There's a pending issue of trying to find an appropriate placement, and oftentimes when the officers or the judge understands that, that can often play into the decision that is made for that student.
Absolutely.
In my experience.
I'm going to be looking at our Facebook page while you do this. We're very interactive.
Okay. Yes, we are. So let's see. We've got another one that came up here from Claudia. She's from Florida. And Jen, she asks, in addition to a discharge summary, what other records should I provide the school? That's a really good question.
Oh, that is a good question.
Well, I would say that, oftentimes if you've ended up in a hospital, that's sort of the crisis. But prior to that, you may have already been seeing a treating psychiatrist or a treating physician through therapy, because your son or daughter has been in therapy for this very issue. And so you might want to reach out to that psychiatrist or psychologist and say, is there anything that you can put in writing for the purpose of giving to the IEP team that says, you've been seeing my son or daughter for X amount of years or months, and it is my professional opinion that you need to rule out XYZ, that this is or her disability will adversely impact education, and ask that treating physician to make some recommendations to the team.
Excellent idea. Again, this is what part of the reason we're doing this particular web show. Very often treating therapists, psychiatrists, psychologists, social workers, family counselors, again, their heads are in the medical model. And so they'll use terminology sometimes that has a very heavy meaning in special education that they don't realize. So I'll give an example. Yeah. Under the special education laws and the cases that interpret the special education laws, the standard for whether a child is receiving an appropriate program, it varies a little bit, again, based on your circuit, but you're entitled to that appropriate program. You're not entitled to the best program, okay? Right. Many doctors will write a note or a letter saying it is in the child's best interests, right, because, they write those, or what would be best for this child to maximize their potential, which is not the legal standard. And unfortunately, sometimes school districts will seize on that and say, oh, well, you're recommending a Cadillac program here, not what the child requires for educational reasons. It's a dicey thing. So I like to make sure that if you're getting a letter from the outside,
help them along.
Yeah, help them along in terms of, because usually when you ask the doctor, you wrote in this letter that the child needs it because it's the best, it's in his best interest. Can he be educated without it? The answer is usually no. Then I want you to say he can't be educated without it. But it's just a matter of that medical terminology versus the educational. So if you don't already have a treating therapist and you're looking for one after your child's discharge, you might want to ask around in the community and find those therapists who are not just excellent therapists, but have experience in working with school districts.
Right. And one more thing that you could be giving to the school district in addition to the summary discharge is, again, if your child has been seen by a psychiatrist or a psychologist and you already have that diagnosis, it's very important that you also provide the school district with that information as well. And I think, diagnosis is one thing, but because that may get you the eligibility into special education or a 504. Right. It is then beyond that, what prescriptive recommendations to have an appropriate program in place that further evaluation may need to answer. Right. Of course, I'm getting ahead of myself, and that's not a question that anybody asked us, but what do we have next? Anything?
Well, it looks like we've got the one from Tony from California who asks, my daughter has never been hospitalized, but I'm worried that she will be, and she's refusing to go to school. Again, school refusal is a really big red flag, and if you're in a situation like that, it's time to ask for an evaluation. I would argue that if a student is missing a tremendous amount of school, and sometimes it doesn't happen consecutively. So most states have truancy laws where after a period of time they have to report the student if they're under a certain age if they don't show up at school. But some kids will go for 3 days, then be home for 4, go for 2 days and be home, or go and then at 10:30 in the morning the mother gets a phone call saying I want to come home, or worse, from the school saying come pick them up because their behavior is out of control or whatever it is. So that kind of school refusal is a really difficult thing. But we want to be very clear, just because your child's never been hospitalized doesn't mean that he or she may not be eligible for services under an emotional disturbance. And of course, as you said, the post-crisis versus pre-crisis, we'd hope that you'd be proactive before, we'd hope the school would be proactive before there's a crisis like a hospitalization instead of after.
Right, and if you do refer your student to an IEP team prior to any crisis or hospitalization, be aware of the fact that having academic achievement failure is not the only criteria for possible entry into special education, because many teams will say, well, in spite of Susie's issues that you're reporting to us parents, she's getting great grades. Right. Everything's fine. Right. So you don't have to just look at academic achievement, but also functional performance. Is the student going down to the nurse's office more than often? Is there a lot of escape behavior into the bathroom, perhaps? Is the student refusing to go to school?
Are there consistent discipline issues? The kids ending up in suspensions every other day, or major disciplinary issues. There's
or
so many red flags: self-injurious behavior, depression. depression.
Yeah.
I mean, there's so many factors, but in none of the analysis, all disabilities under the IDEA do require that the student's disability requires specialized instruction and that it's adversely impacting the child's education. But we always say education is more than just academics, and functional and adaptive skills, as we've talked about, are definitely part of that. So,
Which really feeds right into this next question from Mark from New Jersey, who says, what kind of services can I be asking for if my child becomes eligible under special education? And that's a really great question.
Yeah, it is, and that's where I rely very much on the evaluators, because including the school team. But particularly for me, I rely very much on the outside evaluators, because I'm not a psychologist, and I'm not a psychiatrist, and I'm not a special education teacher or a school psychologist or any number of other people who may be having to answer this question. I want to know from somebody who has an honest, legitimate interest in recommending what the child requires, Right. And then we, as an IEP team, have to figure out whether the child, that goes in the child's IEP, and if it's a related service or a special education service. But for so many parents, there are so many things that the IDEA requires, particularly as related services, that parents don't even realize is part of special education, like parent counseling and training.
Right. And I would say, just to give folks an overall idea of the types of service, perhaps not the prescriptive, individualized recommendations, but the related services that your student may become eligible for are things like counseling at school. And because that's a related service. But oftentimes, Jen, the counselor at school may not be equipped or able to handle or have the expertise to deal with this particular disability. And that a parent should know that counseling doesn't have to happen just at school. It could be a related service that happens outside of school as well, if in fact that's deemed to be appropriate. So it could be counseling. It could be academic support. So an IEP goal might address, helping the student become organized with planning. So you're looking at the academic areas, the emotional support areas. It might be a behavior intervention plan that is put in place to support the student, or it might be some social skills. These are all things that can be overall part of the plan.
Including, and I think it's important, you and I talk about this a lot, parent training. Parent training is a related service under the IDEA, and it's, in my view, probably the most underused related service that's out there, because many parents don't realize that it's available, and many school districts don't offer it, unfortunately. And it really isn't training you necessarily how to be a parent. It's a service.
Misnomer.
It is a misnomer. It's a service that's really designed to allow the parents to understand the student's disability so that they can support them through their IEP, because parenting a child with an emotional disturbance is not an easy thing. Most people who are, when it's your child, it kind of doesn't matter what your background is, because you're a child and you're not objective. But even if you, had training in working with students with behavioral or other challenges, it's still your child, and you may need some support and some training on how to work with your child outside of home. So that may be the kind of thing that gets put into an IEP.
Bob from Connecticut asked a really important question, and I'm glad that he did. He asks, how does all of this fit into transition? And I'm really glad that was asked, Jen, because most often kids who are who have an emotional disturbance and a mental health issue, from a statistical standpoint, boy, that's awfully difficult to say.
Easy for you to say.
You're usually older. You're an adolescent. Okay. So what happens in adolescence? You're now looking at transition, and once you've got these services for your child, don't forget about looking at transition to adulthood, and how does this mental health issue, this emotional disturbance, impact your student, your child, for adulthood. And that's just we could do a whole show on that one.
In
too,
fact,
Jen.
we have the whole series up. It's out now, up on the site on your special education rights.com is the Transition to Adulthood series, and you should check that out. Our tech guys have been waving to us, letting us know we've been talking for quite a while, so we're going to wrap it up. We're so happy you joined us tonight, and we look forward to the next web show. And if you have any other questions, just check us out on our Facebook page or on the site, yourspecialeducationrights.com.